Hi, my name is Ulysse Guerrier. I was born in Toronto. Was diagnosed with sickle cell S-beta thalassemia at the age of 2. I come from a family of 5 children, and 4 out of 5 children had sickle cell disease. Essentially, what sickle cell disease is a red blood cell disorder. So basically, the red cell has an abnormal shape. Instead of having an oval shape, it has like a crescent shape. So what can happen is that people that have sickle cell can have organ failure. So wherever you have blood circulating, you can have a crisis, you can have a blockage. So that can potentially have risk of organ failure. What we'd like people to understand is that this is a conversation, especially in the Black community. We don't talk enough about health and wellness. So for individuals that have a health issue, it seems to be something that happens quite often, that they shy away from talking about topics of health. In the Black community, like, we have a history of stigmatizing people that are either have health issues or don't want to talk about it, keep it a secret in the family. So it's not in our advantage to do things like that. We should be able to have discussion and conversation about how we can improve each other's health. Especially like in the Black community, there's a lot of prevalence of diabetes, high blood pressure, etc. So people with diabetes can often have organ failure and require dialysis, and renal failure, kidney disease, etc., or even heart disease. So if you have a loved one that goes through those illnesses, and you might be like a living organ donor, it's important to have this conversation and to see what kind of planning can be put in place, what kind of tests you need to be able to do, so that you can maybe save a life or give somebody the gift of a second chance at life. When I talk about some of the barriers, some of the barriers is accessing healthcare services. In the Black community, some of us don't even have a family doctor. So accessing healthcare services is something that's primordial that we need to do. Also, going to hospitals, sometimes we face issues with anti-Black racism. We face issues of people don't understanding us. People think that we suffer pain, or we can handle pain more than anybody else. We always feel like we're not being heard, or we've been dismissed when we go to hospital, or people talk to us as if we cannot understand or we cannot comprehend the issues that we're facing with our own health. So that could be very frustrating. That could be even for some people, it could prevent them from going forward and even seeking help. If there's one word of encouragement I can give anybody that watching this, and that suffer from any kind of illness, and or you just got the news of something very devastating happening to you, it's normal, and it's okay to feel powerless, to feel like it's is can that be it? Am I gonna die? Um, you know, Unfortunately, we all gonna die sometime, someday. We don't know when, but the most important thing to realize is that you're still breathing. So while you're still breathing, there's still hope. There's still something that can be done, and that's not the end. So it's try to look at the positive out of even the worst situation, and fight, and not to give up.